Welcome to our presentation about medical services in Alberta. If you are new to Alberta, knowing where to go to get medical help can be confusing. This presentation will provide information about how to use our healthcare system. We will talk about things like where to get services, what is paid for by the government and what you have to pay for, and what to do in an emergency. This presentation is created in partnership with MacEwan University nursing students and Nihil Adult Learning Society. Alberta's healthcare system is publicly funded. This means that the government pays for medically necessary hospital and healthcare services. If you are sick or injured and treated in the hospital or clinic, you will not have to pay for it. To get this free medical service, you need to have your Alberta healthcare card. If you do not have this card, you can still get medical services, but you will have to pay for them. To find out how to get this card, see our video showing you how to apply for your healthcare card. Medical treatment in Alberta is mostly free, but there are also some things related to healthcare treatment that are not free. Sometimes before or after being treated by a doctor or nurse, you will need to buy or pay for things to help you get better. Examples of things that are not free are medications from the pharmacy, calling an ambulance, getting medical support equipment like hearing aids, a walker or glasses, or treatment not related to illness such as going to the eye doctor, the dentist, a chiropractor or a massage therapist. Now that we have talked a little bit about what our healthcare system is and who pays for it, let's talk more about using the different parts of our health system. We will talk about 5 different topics. The first one is about family doctors, which are also called family physicians or primary care doctors. The second is about our free medical advice line called HealthLink or 811. The third topic is about the different types of clinics available. Topic 4 is about immunizations or vaccinations for both children and adults and where to get them. Topic 5 is about 911 and other emergency services. Let's talk about family doctors, also called primary care doctors. They are the main person you go to anytime you get sick, have health concerns, or go for a health checkup. Your family doctor knows your medical history. They can give you more personalized care and help reduce the number of times you have to explain your health history or repeat tests. If you are sick or injured and need some tests or a referral to special doctor, family doctors can make things easy by ordering them for you and telling you where you need to go to get them done. Having a family doctor will help you receive better care, live longer with better health, and reduce hospital admissions or visits to the emergency room. Please note: at the time of this presentation there is a shortage of family doctors, so it may be hard to be accepted as a patient by one. That does not mean you will not get the care you need. If you cannot get a family doctor, you can go to a walk-in clinic or urgent care for your medical needs. Where do I find a family doctor? Alberta is currently facing a shortage in healthcare workers. This means that not everyone in Alberta has a family doctor. It is difficult, especially in rural communities, to find a family doctor, so it is important that you begin looking as soon as you can. The first place to look is at your local medical clinic. The workers there will know which doctors are taking new patients. You can go in and ask or simply call them. Another place to check is the Primary Care Network website or the Rural Specific Primary Care Network, including Trochu and Three Hills. Use the QR codes on the brochure to quickly search these sites. You are not guaranteed to find a doctor, but it is important to keep looking. When should I see my family doctor? You can choose to book a visit to your family doctor anytime you would like. The most common reasons to go to a family doctor are: you are not feeling well or have a health concern, or you have symptoms of a disease. You have questions about your current health status, something has changed in or about your body. You have some questions about a disease you've been living with, or you need some help taking care of it. You need birth control or pregnancy care. You want an annual checkup. Or you need medication to be prescribed to you, or you need a prescription refill, which is asking for more medication of the ones you are already taking. This list above is the most common reasons, but not the only reasons. Doctors often give referrals to nutritionists and physiotherapists for help with those areas. How to book an appointment. Making an appointment is as simple as calling your local clinic. See the brochure for locations near you. Even if you don't have a family doctor, you can still go to the medical clinic to see a doctor or nurse. The benefit of having a family doctor is being able to see the same doctor every visit. By doing this, the doctor can get to know you and your medical history. If you book an appointment and, for any reason, you are not able to attend, just call the office to cancel. Making an appointment and not showing up without any explanation is considered rude in Canada. Please note that some doctors might charge a fee if the appointment is cancelled too close to the appointment date. What happens in an appointment with your family doctor? What is talked about during an appointment with your family doctor is up to you. However, the following is usual. Reviewing new diagnoses. Talking about medications, new prescriptions, or refills. Listening to your health concerns or questions. Providing guidance regarding child or youth development. Talking to you about your personal habits/lifestyle changes such as losing sleep or gaining weight. Talking about mental health issues and challenges in life you may be facing. If there are many things to talk about with your doctor, try to keep it to 1, 2, or 3 subjects per visit. If your family doctor thinks you need specialized care, they will refer you to other services and/or doctors that can help you. Remember that you can ask any questions at any time. It is important to note that you must always bring your healthcare card with you to the doctor's office. 811, also known as HealthLink. 811 number is for general health concerns. It's the easiest and fastest option if you think you are feeling unwell or have any questions and you are not sure what to do or where to go. When you call 811, you will be able to talk to a nurse and they will give you medical advice over the phone. 811 is available 24 hours a day, 7 days a week, so you can call at any time of the day or night. Some of the most common things 811 helps with are answering general questions regarding your health and symptoms. Give you advice on when to go to the emergency at the hospital if you're not sure. Connect you to appropriate health providers. Book vaccines such as COVID-19 and influenza. They can also answer questions you might have about the medical system in Alberta. See the brochure for more information about using the HealthLink. Topic 3. Clinics. Walk-in clinics. Allows you to receive medical help without making an appointment. You can meet with a doctor at these walk-in clinics, but depending on the time of day and how busy it is, you may have to wait a long time. Follow-up services are not included and usually with your family doctor in your local clinic. Check the brochure to see if there is one near you. There are also health clinics. These are usually where you go for appointments with your doctor. Some health clinics have family doctors or other health professionals that meet with clients. There are also types of health clinics that specialize in specific health issues such as diabetes clinics, HIV clinics, cancer clinics, and more. These tend to be more common and available in the big cities. Topic 4. Immunizations and vaccinations. Immunization services are offered in health centers and pharmacies. Most sites will do vaccines for adults, influenza, or COVID-19. Routine immunizations for newborns or children are usually done by health centers only. It's a good idea to call ahead and ask the site if they have the vaccine you are looking for. Please note, if you have immunization records outside of Alberta, you can upload them online through My Health or in person by booking an appointment at a public health center to find out what vaccinations you require. How do I book an immunization appointment? Option 1 is to call 811. Option 2 is to call a health center site or pharmacy directly. Option 3 is to go to the Alberta vaccine booking system to book your immunization appointment online. See the brochure for the QR code of this website and for more information. To call health centers and pharmacies near Knee Hill, look at the brochure which has a list of their phone numbers. Topic 5. 911 and emergencies. 911 is the emergency phone number in Canada. It contacts police, ambulance also called EMS, and firefighters. 911 is for situations where immediate help is needed or when a life is in danger, such as when a person needs a rescue. There is a fire. You saw a crime or a crime is occurring. There is a mental health crisis. Or you or someone else is having a medical emergency. When you call 911, you will have to tell them if you need police, ambulance, or firefighter, what happened, and your location. Remember to follow the directions of the person on the phone and to stay on the call until help arrives to where you are. When talking, it helps to take a deep breath and to speak slowly. Don't hang up. Let's talk about what counts as a medical emergency. A medical emergency is anything that can cause death or permanent harm. When you call for an ambulance, it means that someone's life is in danger and they need to go to the hospital fast. Common examples include trouble breathing, severe injuries, loss or change in consciousness, non-stop bleeding, blood in your cough, vomit or poop, any sign of a heart attack such as chest pain, sweating, nausea, trouble breathing, and feeling dizzy. And finally, any sign of a stroke such as face is drooping, one side is weak, and the person is talking weird or slurred. Again, what I just listed were common examples of medical emergencies, but please know that this is not all possible examples. At the end of the day, if you are in doubt and think someone needs help, it is better to call. Let's talk about what happens at the emergency room, also called ER for short. When you need emergency services, you will most likely be directed to the emergency room at a hospital. Upon arrival, you are going to follow a process with several steps. Emergency rooms are usually busy and full of patients, so every step might take a long time. Triage. Patients who have the worst medical issue are seen first, so you may need to wait a while. Staff will take some information about what you are feeling/experiencing. A nurse will quickly see you and prioritize you depending on the seriousness of your illness or condition. Treatment. When the wait is over, you will be taken into a treatment room where more specific further assessments are done by the nurse. Here they will prep you and address symptoms. Assessment. You will then be examined and an emergency staff doctor or nurse practitioner. They will assess and order tests, like blood work, X-ray, MRI, to diagnose and treat your current medical condition. Diagnosis, treatment, and discharge. After your care, it will be determined whether you can be safely sent home or if you will need to be admitted to the hospital for further care. Let's talk about emergency transport costs. As we mentioned before, not everything is covered through the Alberta Healthcare Insurance Plan coverage. Emergency transportation fall into this category of uncovered services. The province has two fees: $250 if a patient is not transported and $385 if a patient is transported. If you are not a resident of Alberta, there is an additional charge of $200. $450 if a patient is not transported and $585 if a patient is transported. This cost does not have to be paid to the ambulance picking you up. Your information will be collected by the first responders in the ambulance and provided to the province that will later send a bill to your address for payment. Let's review of where to go when you need medical help. Option 1. Family doctors and walk-in clinics. Use this option for regular sickness and non-emergency health needs. Book an appointment at a clinic or go to a walk-in clinic at your earliest convenience. Option 2. Health Link 811. Use this option if you are unsure where or when to seek medical help, or if you need guidance regarding a medical condition. Call 811 and speak to a nurse. They will be able to advise you what to do. Option 3. Emergency. This is very important. If you know it's a medical emergency, call 911 immediately. The operator talking to you on the phone will be able to tell you what to do, send an ambulance, or ask you to go straight to an emergency room. Just a reminder that this presentation has a brochure that will contain access to most of the links and key information that you saw in this presentation. Check the brochure for the location, address, and phone numbers of medical services in or close to Kneehill County as seen in this chart. Thank you for watching our presentation about medical services in Alberta that was created in partnership with MacEwan University nursing students and Kneehill Adult Learning Society. We hope you have a better understanding of where to get services, what is paid for by the government and what you have to pay for and what to do in an emergency. If you have any questions, please feel free to reach out to kneehilllearn@gmail.com.